Hello everyone, welcome to second video of NEET-PG 2023 recall question discussion. So starting with question number 11. So this was one image based question, very straightforward question, and the question asked was what is the diagnosis. As you can see here, one sign that is known as stipple sign. So this is nothing but stipple sign image was given in the X-ray neck. So where it is seen stipple sign is seen in croup, also known as laryngotracheobronchitis. So acute laryngotracheobronchitis or croup is the right answer, where this stipple shaped structure, see this is the stipple and exactly similar structure, similar type of image is seen in the X-ray neck AP view. So this is stipple sign seen in croup or acute laryngotracheobronchitis. Okay, so the answer will be croup or acute laryngotracheobronchitis. So this is the answer. Next, coming to question number 12, primigravida female, known case of bronchial asthma. So primigravida with bronchial asthma, profuse bleeding after delivery, uterus was atonic. So which drug should not be used to control bleeding? Among the options given, the answer will be carbopost. So the answer is carbopost. I am explaining why the carbopost is the answer for this question. This is primigravida female with profuse bleeding. So this is a case of PPH or postpartum hemorrhage. As the patient is having bronchial asthma, if you use carbopost, then what will be the effect? As carbopost is prostaglandin F2 alpha agonist. So PG F2 alpha agonist. So this prostaglandin will increase or aggravate the bronchial asthma. So that is why, because of there is chance of aggravation or acute exacerbation of bronchial asthma, that is why prostaglandin analog is avoided in case of bronchial asthma patient. So the answer will be carbopost. Carbopost should not be used to control PPH in a patient with bronchial asthma. Coming to question number 13, a child while playing plucked a fruit and consumed, brought to hospital with restlessness, photophobia, not able to pass urine and dry hot skin. As I have discussed in my previous video, first video of today's recall session, features of atropine poisoning. So dry, photophobia or dilated pupil, retention of urine, restlessness, drowsiness, all are the symptoms of nothing but atropine poisoning. And what is the source of atropine? In fruit, this is nothing but dhatura seeds. So the one option is dhatura. So dhatura option was given in option number A and B. And the second part of question was asked about the antidote. So poison is dhatura, it is very much clear, but the antidote is it pyridoxine? No, it can't be pyridoxine. So the answer is dhatura is the poison and the antidote is physostigmine. It is not neostigmine, because physostigmine can reverse the physostigmine can cross the blood-brain barrier and it reverses the central nervous side effects. So answer is dhatura poisoning and antidote will be physostigmine. Coming to question number 14, which of the following autopsy technique is done in HIV positive patient? So HIV positive, which autopsy technique is followed? Is it Virchow? Definitely no. Is it Letoli? No. Is it Ghons? No. The answer is Rokitansky. Yes, this is the right answer. Rokitansky in situ dissection. Why in situ dissection is followed? Because it is infected body. So in case of infected body like HIV, Rokitansky in situ dissection is preferred. So this answer will be Rokitansky for HIV positive dead body autopsy technique. Coming to question number 15, during post-mortem examination, temperature of a dead body is more than 39 degree. So this phenomena is seen in, first of all tell me what is this phenomena? Yes, this is nothing but PM caloricity or post-mortem caloricity. So which are the condition in which post-mortem caloricity is seen? So post-mortem caloricity is seen in case of sunstroke, pontine hemorrhage, strychnine or tetanus poisoning, bacterial or viral infection, especially lobar pneumonia, typhoid, encephalitis. Also in some intense asphyxial death, But in today's question, among this option, the best option will be septicemia, bacterial or viral infection. Following septicemia, you may find post-mortem caloricity or increased temperature of the body even after death. Coming to question number 16, white fingers seen intermittently. So, white fingers seen intermittently in workers using various machinery, likely cause. It is typical case of secondary Raynaud's. So, this is intermittent paleness. This is nothing but intermittent paleness of fingers is secondary Raynaud's phenomena, and this white fingers because of machinery handling and secondary Raynaud's phenomena is known as vibration white finger or hand arm vibration syndrome. So, this vibration white finger is a typical example of secondary Raynaud's phenomena. So, this vibration causes secondary Raynaud's phenomena. This causes white color discoloration of fingers. So, white fingers or vibration white finger is due to vibration. Other options are wrong, like cement wet hat causing candidiasis, paints and thinners. Coming to question number 17, mid diastolic murmur with prominent A wave. What is the diagnosis? So, prominent A wave, mid diastolic murmur. Mid diastolic murmur either mitral stenosis or tricuspid stenosis. Prominent A wave, definitely it is seen in tricuspid stenosis. So, the answer will be tricuspid stenosis. Here you can see the list of example where prominent A wave seen. See here, tricuspid stenosis or atresia where prominent A wave is seen, and these are the rest of the example where prominent A wave can be seen. So, the answer is tricuspid stenosis. Coming to question number 18, following splint is used in which nerve palsy? So, which nerve palsy? This is which splint? Yes, you are right. This is cock-up splint. This is cock-up splint. Cock-up splint is used for treatment of which condition? Yes, you are very much right. This is nothing but wrist drop. So, wrist drop occurs because of palsy of which nerve? Yes, it is radial nerve. So, the question asked was about the radial nerve palsy. So, following splint is used for radial nerve palsy manifested with wrist drop. So, the answer will be radial nerve palsy. This cock-up splint is used to treat the wrist drop. Next, coming to question number 19, NEET technique of autopsy, which of the following? So, is it Rokitansky? No, already I have told you in my previous question. So, Rokitansky is in situ dissection. And what is Ghon's? Ghon's is en bloc. So, here you can see the types of post-mortem methods. Rokitansky is organ dissection in situ. Virchow is, it is organ removal individual, and Ghon's is en bloc. So, separate block. So, Virchow individual, Ghon's en bloc, and Rokitansky dissection in situ. So, the question asked about the NEET, so it is definitely the answer is Letourley. So, the answer is Letourley NEET technique. Ghon's en bloc, wrong option. Virchow's organ is wrong option, individual organ. So, the answer is NEET technique, Letourley. Coming to question number 20, female patient currently pregnant, delivery of twins 3 years back. So, female patient is currently pregnant. What is the gravida and parity? So, what do you mean by gravida? Gravida is number of pregnancy woman has regardless of outcome. So, already she had one pregnancy beforehand for twin pregnancy, now she is pregnant. So, the gravity is 2. And what is the parity? Parity is number of deliveries after 20 weeks. Even if it is a twin delivery, but number of delivery after 2 weeks seems to be 1. So, parity is 1. So, the answer will be G2P1, gravita 2, parity 1. So, this is question number 11 to 20. In the next video, I am going to discuss question number 21 to 30. So, stay tuned for the next video. Thank you very much for watching. Subscribe.